Hi, Rick Bukata here. Some of you know that I'm affiliated with the National Emergency Medicine Board Review. We've been doing that course for 24 years. A lot of you have taken it. And as you can envision, I'm interested in what's happening with the MyEMCert exam and about the new guy that's going to be replacing it, the MyEMCert Modular exams. First, let's go into this CERT exam material. I went into their website and I spent, actually a couple hours trying to put all of this together. I think I understand it now, and I'm going to basically kind of try to give it to you in 10 minutes or thereabouts. This is current as of July 17th. That's when their frequently asked question was updated on the MyEMCert exam. Now, open book exam. The problem with open book is, yeah, it's a kinder, gentler exam. Everybody gets a trophy, no stress. No, the fact is there is stress. It's a timed exam, so the clock's running, and you have open book. Well, I get all these books open. I get Tintin, I get Rosen, I get all this other stuff. How do I look up questions and do it promptly? And I talked to a fellow that took the first exam. He said, I used every minute of that exam. And the trap you can get in is starting to look up questions when, I think I know I'm not sure, look it up kind of thing. Next thing you know, you're running out of time. So I think open book in some ways adds a new source of stress in this test. So open book, one of the things we did, National Emergency Medicine Board Review, we provided everybody who took it over the last 2 years this search engine called MyEMCert, quick search. And it'll pull up any of the slides. We have over 2,000 slides in that database, but you want to pull up the slides on DKA, bam, put that in, DKA. WBW, bam, put it in. Anion gap, bam, put it in. You got the slides on it within literally seconds. And so I think that'll help a lot in terms of giving people who've done the NEMBR, they know what's in the manual. I just need to find the slides on it. Okay, so that's open book. Number two, it's take it home. So obviously it's the honor system here. Absolutely nobody's underneath the desk. Feed the answers. And yes, it is a timed exam. So that adds a degree of stress to the endeavor for sure. They expect you to complete the exam in one setting, just like you would do it if you were in one of the testing centers. But here, see this paragraph? This paragraph says you can stop, bam, at any time, and the timer of the exam will stop, and you can restart it after some break. They don't say how long, half hour, 2 days, I don't know, and the exam starts again. Now, they basically will probably be more specific when you're actually taking the exam and they're giving you instructions. But right now, it doesn't say that. It just says you can stop at any time and restart, and the clock stops. That's really strange. The clock stops. Timed exam. It doesn't work. It's the usual 190 questions. At the whopping $1,950 comes out to be $10.26 a question. And yes, you're going to get at least 90 days of sweating it out. Did I pass? Did I not pass? The gold standard here of what we need to do is you go onto the ABEM website, you go on to Stay Certified, which is on the main screen that you're going to land on, Stay Certified, and then on the right side there's a box that says Requirement Checker. You click on that box, and then you enter the year your certificate ends, and it tells you exactly what your options are and what you can and can't do. And the luckiest people on the face of the earth right now are those who have to recertify in 2020. Why? Because that's the last group who's going to get 10 years worth of certification. Last group, number one. Number two, it's open book. That's nice kind of thing. Number three, you get 6 additional months to take that exam. Normally, you would have to take that exam in November of 2020. And if you didn't, that's too late. You blew it. Now you're going to get an additional 6 months to take that exam, so you could take it in the spring of 2021. Technically, you have until, I think, June 31st to take it, but there's an exam in the spring, so the date undetermined yet. So definitely take that exam in November. Yeah, you were going to do that anyway, but if you screw it up, you can take it again in the spring. Nobody else is going to get a break like that. So you have really gotten the best deal out there. Everybody after you, you're out of luck. This is, I went over that already. So 2021, bad. Yeah, it's no good. You've got your LLSAs that you have to do in the improvement in medical practice kind of thing. But you have to pass 4 EMCert exams, module exams within a year. 4 within a year. They're up to 50 questions apiece. It's like, or you can take the concert exam because the concert only goes away in 2022. So 4 of these in 1 year or the concert. I don't know. They're both open book. Maybe it'd be better to take the MyEMCert, but I certainly don't know. But no matter what you do, concert or the 4 modules, you get a whopping 5 years. 2022, there's a gradual transition from taking 4 of these exams in 1 year to taking 3 of these exams, 4 of these exams in 2 years versus 4 of these exams in 3 years until it's basically at baseline. At baseline, they want you to take 4 exams over a 5-year period. 4 exams over a 5-year period. You get certified every 5 years, 4 exams over a 5-year period. And this is more of the same. And more of the same. And this basically says there's no advantage to taking the concert exam early anymore. If you take it in 2022, instead of taking the MyEMCert modules, you'll still get 5 years certification. The MyEMCert program is kind of interesting. It's 4 modules over 5 years, plus the improvement in medical practice, one of those every 5 years. It's open book, just like the new concert exam is, or the same concert exam, but open book, and up to 50 questions on each of the topics. And you can choose the topics that you want to be tested on. And one of the things that they specifically say is that they're going to incorporate the bread and butter issues of emergency medicine. This is their way of saying, we're going to make this exam more practical, more concurrent with what you do in practice, less esoteric trivia, that kind of thing, implying that that's what the concert exam was about. And who knows? You get a median score with these exams, and they give you the right answers and the wrong answers, and they tell you why the right answer is right and the wrong answers are wrong. So they think they're now in the education business about that kind of thing. They don't specify what the passing grade is. There are 3 exams. So if you flunk one, you can take another, but the other exam is different than the first. And if you flunk that, you can take a third, and that exam is different than the other 2. So there's 3 versions of the exam for each module. You get 3 chances to pass it. If you can't pass it in 3 times, I don't know. They have about 1,200 ER docs now piloting these. I know one doctor who's gotten 3 modules for 3 tests for one of the modules. Obviously, he's sworn to secrecy, unfortunately. And here are the modules. Some of the topics seem kind of reasonable. They're by location. They're by. They talk about case presentations. I think that's going to be the theme here. Anyway, abdomen and pelvic. I got that. Abdomen and pelvic. I got that. Abnormal vital signs. What the heck are they talking about here? You have fast pulse, slow pulse, fast respiration, slow respiration, high blood pressure, low blood pressure. What permutations are there of those 3 vital signs? It's like, holy smokes, this is talking about working backwards. I mean, you're going to be all over the dartboard. And, you know, there's no pediatrics here. So pediatrics, I guess, is thrown into all of these modules. Trauma and bleeding. Okay, I got trauma and bleeding. Right. Thoracorespiratory. Okay, I got everything in the chest. Neurology, everything in the brain, spinal cord. I got neurology. Okay, I got that. Social and behavioral health. Good luck in making 50 questions on social and behavioral health in emergency medicine. Good luck. Head, neck. Yeah, I got that. Head, neck. All right. And non-traumatic musculoskeletal, like your non-traumatic back pain. Is a shoulder dislocation traumatic or non-traumatic musculoskeletal? I don't know. But in any case. And in addition to those 50 questions, up to 50 questions, 20% of them are going to be about new advances in emergency medicine. The difficult thing here is new advances in emergency medicine are sometimes disproven later on. So how new should they be? Are they new yet definitely proven, or new leading edge and maybe turned out to be wrong? So there's a kind of a gray zone there of how new is new. Before, when we were taking the concert exam, you knew that they were not going to be talking about anything new in that exam. Well, not anymore. Okay, in conclusion, first of all, the concert exam is gone. 2022 is the end of it. Served us well for a long period of time, but goodbye, 2022. Those of you who are taking the concert exam in 2020 are those who have gotten the gifts from the gods. You get a 10-year certificate, and not only that, you get to take it open book, and not only that, you get a 6-month extension. Normally, you would have to take an exam in November, but now they're saying you can take it in the spring when they do it again. So you have 2 shots at that exam. So you better take it in November. If you flunk it, you can take it again in the spring. Terrific. In 2021, 22, everybody thereafter kind of thing, when you pass, no matter what exam it is, it's going to be a 5-year certification. And yeah, you can take the concert exam till 2022, but it doesn't matter. It's 5 years kind of thing. One of the things that gets interesting is that in 2021, you can take the concert exam or take 4 of those MyEMCert exams. Well, there are up to 50 questions. You're going to do 4 of those or the concert. I don't know. In 2022, you have 2 years to take 4 of those MyEMCert exams. So basically, there's a gradual transition. Look up on the ABEM website exactly what you need to do for the year that you are recertifying. Actually, they don't call it recertifying now. Just your certification ends, and you get a new certification, which some people would call recertification, but they don't. And prepare to pay $280 for the rest of your professional life. That's about it. So I hope that helps. I think I distilled it down, but this is a moving target, so periodically you may need to go on the website and see if they got any updates. But this is current as of their their August 4th iteration in general, and the frequently asked questions July 17, 2020. Okay, thanks for listening. Bye for now. Good luck on the exam.